Hospitals are facing an influx of alcohol-related cases and trauma admissions. They say this is putting pressure on the system at a time when attention needs to be given to COVID-19 patients. Limited beds do not make it any easier. So for more insight on this, I'm joined now by the Chief of the Trauma Unit at Milpark Hospital, Professor Kenneth Boffard. Prof, thanks a lot for joining us this evening. Talk to us a little bit about the realities that you're confronted with on a daily at the Trauma Unit.
Well, good evening, Faith. Good evening to Lani. Good evening to your listeners. Trauma took a big dive during lockdown. Our cases went down by 70%, mainly because there was much less in the way of alcohol. Now that that's come back, and I guess that the law enforcement are otherwise distracted, we're having an incredibly busy time. Yeah. I know Baragwanath got their first drug patient by lunchtime on the first day of stage 3, that is by lunchtime on the Monday. We are seeing up to 60% of all car crash victims and up to 80% of all interpersonal violence victims being over the legal limit. Alcohol has placed a huge load onto the units at the very time when we can least afford it. The finite resource is beds. The finite resources is nurses. Most of them have had to be deployed to look after the COVID load. As a result, if you have a crash, the chances are that the nursing staff will be at full stretch. And that's a huge problem for us. And we are absolutely full.
Yeah, I mean, Prof, as you're saying this, I can completely empathize with the realities that I'm sure yourselves as well as some of the healthcare professionals have to deal with on a daily as a result of this lift of alcohol banning. So then I must ask, will the instilling of an alcohol ban, reinstilling thus of an alcohol ban, put less pressure on the system and therefore allow you to focus more on the COVID-19 patients?
I don't want to comment on an alcohol ban. The reality is our peak times are in the middle of the night. Our peak times are at times when people are locked up and get drunk or drive. So a curfew in many ways will help us more than an absolute alcohol ban. Though clearly both will contribute. But our peak times, night times and weekends when people are not working, and with nothing else to do, they then become a huge load on the system.
Yeah, and then as such then, when it comes to some of those patients that you're taking in with COVID-19, has that not then stretched the system even further, and how so? I mean, what are some of the healthcare professionals having to deal with when it comes to looking after patients now specifically related to the COVID-19 virus?
Well, the sheer volume of patients is overwhelming most of the hospitals. We saw it in the Western Cape. You're absolutely seeing it in the Eastern Cape. Gauteng, the major university hospitals, Bika and Pretoria, Charlotte Maxeke, Barra and ourselves, we are coping, but we're pretty much at maximum limit. Many of our nursing staff have, in fact, developed COVID. 50% of our trauma surgeons became COVID positive and have now finished their quarantine and fortunately on the whole are doing extremely well. So it's cutting not into overwhelming the beds, but it's actually reduced the staff available to look after them.
Yeah. I have to ask you this, Prof. What would you like the President to say this evening? This is coming specifically now from doctors, from nurses, from healthcare professionals who are dealing with the realities of a COVID-19 pandemic every single moment. What would make it or make life easier for you as those in the healthcare system?
Better policing of day-to-day activities. We, in the last month, had the highest number of gunshots at our hospital that we've recorded since 2002. So the police are distracted. The police don't have the time to enforce anything. I would like to see a curfew. I would like to see restrictions in the way alcohol is sold. Personal view, I would like to see the tax on all alcohol doubled and that money put into health resources.
Professor, before we let you go, the mental state of a lot of our healthcare professionals is also being compromised simply because of the negative impact that this virus is having on their reality as well as their ability to perform in some instances. How has that been for a lot of those individuals that are particularly at the Milpark Hospital? How are individuals actually coping in the midst of a pandemic and in the midst of this uncertainty?
They're absolutely desperate. The strain, not wanting to get infected, not wanting to bring it to your family, not wanting to bring it from the taxis into Milpark. Unfortunately, there's been no enforcement of the crowding of taxis. That has been one of the biggest catastrophes we've seen. We're already seeing cases as a result of crowding of taxis and absolutely no enforcement. The protective gear is extremely hot and heavy to work. The inability to communicate with patients is playing a strain. We have counseling in place, we have support in place, but the reality is whatever we do, unless what happens outside is improved, is not enough.
Professor Kenneth Boffard, Trauma Unit Chief at Milpark Hospital. We'll leave it there for this evening.